Hi guys! Welcome to my channel. It's me, Chris, your crazy nurse RN. For today's video, I will be telling you 5 important things that I noticed here in the US while I'm working as a nurse. So at some point in our videos, I will be comparing my practice back in the Philippines and here in the US. As you all know, I'm a nurse from the Philippines. I started working as a nurse back in 2013. I work in bedside nursing for quite some time. Then I work in the academe as a clinical instructor and professor. Now I'm a bedside nurse working in a facility here in southern Indiana. These are the 5 important things that I've noticed here in the US. And I believe this will be important for those nurses who are planning to work here in the US. So it's kind of bit different in terms of practice, in terms of the process, how it is being done here in the US as compared back in the Philippines. So here are the 5 important things that I have noticed here in the US as a nurse. I know that there are a lot of things that I wanted to share with you that I noticed in my practice, but I selected only 5 things that I think would be beneficial for those nurses who will be deployed or who will be working here in the US. So the first one is, in my facility, we have this so-called a Howard cart. It's basically a cart with a computer. We have the monitor where we chart our nursing care. We also have the keyboard and we have the mouse. Basically, it's a computer, but it is set up as a cart, so it can be as tall as I am, or you can adjust it based on your height. So it's kind of fancy though. And what is the important feature of that cart is you have a scanner. So a scanner is a very important equipment or device, especially when you're giving treatment and pills or medication to your patients. So what you're gonna do is, first you have to scan the wrist band of the patient. So each patient has an assigned barcode. So you have to scan that first before giving the medication to make sure that you are giving the right medication or treatment to that particular patient, just to avoid medication error. Then after that, once you have confirmed that it's the right patient, then you have to scan it through the different pills or treatments that he or she is getting. So that's kind of safe practice, you know? It's a very important feature of that Howard cart. And also that cart that is also equipped with 6 drawers. I don't know with the other facility how many drawers they have, but in us we have 6 drawers because we usually get a maximum of 6 patients in a shift. Sometimes we get 7, and that is when we are really understaffed, but mostly we get 6 patients maximum. Sometimes we get 4 patients if we are lucky, if we are staffed well. Sometimes we get 5 and 6, you know. Also, those drawers, you know, it is intended for each patient's room. So if you have 6 patients, you have also 6 drawers, and you have to put your treatments and pills. We usually call pills here in the US. I know in the Philippines, when you say pills, it could mean like a woman is taking a pills like contraceptive, but here we usually call it pills, medicine, a tablet, capsule, you know. They are all the same. They are all medications taken by our patients. So we put our medicines there, we put our treatments there in each drawer based on the assigned room. So it's kind of organized for that matter, because you get to put all your medicine there and you just have to scan it whenever you are needed to. So yeah, it's kind of cool. And also, at the bottom of those 6 drawers, you have 2 big drawers. Those are intended for your supplies. So you can see normal saline flashes there. If you have patients who have an IV or a midline, you use that. We usually flush it every 6 hours to make sure it's patent and unclogged. Insulin syringe, we also have your blood sugars, lancet and strips there. You also have your gauze, band-aids, or whatever you need, when giving treatment and medication to your patients. It's everything in there. And at the back of your cart, you have your medicine cup where you put your pills in when you pop it off, and you put that on the medicine cup. Also, we have cups there if the patient needs some water. At least you have a ready cup available in your cart. And also you have straws, you have your utensils, fork, spoon, some dressing materials, and so on. So it's kind of cool to have those because you don't have to go back to the nurse's station to get some of the supplies that your patient currently needs. So it's easy, it's not time consuming, it's efficient. As compared in the Philippines, you only got a tray, your medicine, so you have a tray, you have your pills there and all those stuff. Then if you forgot something, you have to go back to the nurse's station and get it. So there's no other way that you can, that you can ask somebody. Probably if you have a friend or somebody that you are close with, you can ask them, can you get me something? But most of the time they are busy working too. So all you have to do is to go back in this nurse's station and get something. I remember when I was working back in the Philippines, I was assigned in this 32 bed unit. It's a medical surgical adult unit, and it's a long way. So sometimes you get patients from each end. So you got patients from room 1 and you got another patients from room 32, which is the far end of that hallway. So it's kind of time consuming that when you got into a patient's room and you forgot something and you have to go back and get it and go back again, that would be a lot of steps. That would be a lot of of work for you. So for me, I find this Howard cart and scanning very efficient and very nurse-friendly equipment and device. So that's a good one. The other one that I am really happy that we have it in here in the US is by using the Pyxis medicine dispenser. So it's like a pharmacy, but it's like a device, okay? It is a device where there are a lot of drawers, and each drawer has medicine, has pills that you need for your patient. So all you have to do, it's like there's a small computer in there. You have to log in your credentials. After that, you do your fingerprinting. So you have a fingerprint there because medicines are very important. You don't want other people to pull meds under your name or under your credentials, so it's secured. You have to do your fingerprint because in that Pyxis, in that medicine dispenser, there are also narcotics, and we know narcotics are highly addictive medicine, and you don't know, you might have coworkers, you might have other staff that are addicted to some medicine, but I haven't, in my practice, I haven't seen or experienced one. I just heard it through the news or from friends who are talking about it. But just to make sure, just to be safe, so just use your own credentials. Don't share your credentials to others. You need to be careful about that. So going back to that Pyxis, it's called Pyxis here. It's a medicine dispenser machine. It's cool. We have a Pyxis here, which is being replenished by pharmacists every shift. So it's kind of cool, It's kind of cool to have those medicines that are readily available at the bedside. I mean, at the nurse's station, because our Pyxis is located at the med room near the nurse's station. So yeah, that's kind of convenient, and I'm happy about it. Because I remember back in the Philippines when I was working there as a nurse, we can charge patients medicine through our own pharmacy. But a nurse or an aide should have to go down to the pharmacy and get those medicine and go back again to the station and give it to the nurse and administer it to the patient. But in here, you don't have to do that. It's It's there in your nurse's station. Just get it and give it to your patient, especially if your patient needs it immediately, so you can just grab it and have it at hand and give it to your patient. And that's kind of efficient, convenient, and safe for everybody. So that's the second one that I just wanted to share with you. It's a good practice here in the US. Another one is PTO hours. Okay, so PTO means paid time hours. So these are the hours that you accumulate while working shift here in the US. So here in Indiana, I know that they have different policies in terms of how many hours you'll get in each state or in each area here in the US. But in here, I usually get 5 point something hours per week for 2 weeks. For 2 weeks. So because we're paid bi-weekly. So yeah. So you accumulate that hours until such time that you decided to go for a travel, wanted to go for a vacation, so you can use that PTO hours. So while you're having your vacation or having your travel, you are still you still got your salary, or you still get paid. So that's kind of cool here as well, because it is converted also by your regular salary. Like for example, if you have 10 hours of PTO, so it will be multiplied. If your hourly salary is $50 an hour, so that will be 10 times 50. So you'll get that amount. But of course, some deductions will be implemented, like your insurance, like your taxes, 401k, and all those stuff, But it's kind of cool because you get something out of it. Back in the Philippines, I believe what we did there is we have a vacation leave, and that was a paid, and that was a paid vacation leave. So that's what we get. We don't have PTO in there. They just give you an annual vacation leave. That's it. It's a paid one. So that's kind of cool. I like the PTO system, to be honest with you, because you get to control your number of hours. You get to control when are you going for vacation, when are you going for a travel. It's cool. The other one is, which I am really proud as a nurse here in the US, is you got a chance to be a nurse practitioner. We actually have a nurse practitioner in the facility, and it's kind of cool because the nurse knows how the life of a nurse is. So he or she can understand what you are going through, and most of the time they are really nice. Sometimes they would help in terms of nursing procedures because they know how to do it. So I like to have those nurse practitioners. Here in the US, there are different regulations in terms of nurse practitioners. Based on what I have read, there are some states who actually permitted nurse practitioners to work 100% independent. So they can do what a physician does, for that matter. And there are some states who would give just 75% independence. Some would get 50% independence, so they will be under the supervision of a physician. So yeah, it's kind of different here. But you know what? Bottom line of this, they can, diagnose, they can treat patients on their own. And that's kind of awesome. And I feel so proud about it. A nurse being a healthcare provider, it's kind of a huge accomplishment for the nurses. And here in the US, there are actually a lot of healthcare providers here. First, we have that, physician, the medical doctor. They also have that they also have that physician assistant, and we have the nurse practitioner. So it's kind of cool. So nurse practitioner program is a good thing here in the US. The last one that I wanted to emphasize is the schedule. You have the freedom to choose your schedule here in the US, which is a very convenient and very cool thing that I experienced here in the US. Before, when I moved here, that was last year, I was assigned as a day shift nurse. So I usually work 6:30 to 7 p.m. I mean 6:30 in the morning and 7 p.m. And I worked that for almost a year. That's my schedule. It's fixed. So I worked that days, and after that I decided to shift to night. I work at 6:30 p.m. to 7 in the morning, and I work it until now. I like night shift, to be honest with you. It is slow. You have more time for your patient. You have more time to check your chart. You have a lot of time to actually look at things and check everything, which I really like. That is safe practice to make sure everything is correct, everything are done, nursing procedures were executed, were delivered, and that's awesome. And apart from that, being in the night shift, you get night differential, so there's an added pay for you apart from your apart from your regular pay. And since I work weekends now, so I also get another incentive pay per hour also for that. I don't think it's ideal for married couples who have kids because they usually spend more time during weekends. So some of those nurses doesn't really like to work weekends, so they prefer to work weekdays. So it's kind of not ideal for those kind of setup. So, but for me, since I'm single, I don't have anybody with me. I don't have a family. I don't have kids or whatever it is. So I have my time. So I prefer to work weekends because of the pay, because of the differential pay, and because I'm comfortable working on that day, and I'm happy, I'm happy working that shift. That's basically it. Yeah, so as compared back in the Philippines, our schedule was unpredictable. When I say unpredictable, sometimes you work days and sometimes you work nights. Sometimes you work 8 hours, sometimes you work 12 hours. And I realized that it's not actually healthy because our body changes, our body clock changes. So in here, I realized that this schedule actually works for me very, very well. Because my body has been doing that since probably last year. I can have proper sleep, I can have an adequate sleep, I can anticipate my activities, I can go somewhere, I can plan my trip to wherever I wanted to go because I have a fixed schedule. So it's a good thing for me too as well. And it helps a lot, to be honest with you, especially us nurses. Our job is so stressful. We have anxiety all throughout our shift. We don't know what's going on to our patient. We don't know what will happen in the next hour. So those are the things, that could somehow reduce our anxiety, that could somehow give us a better quality of life while working in a highly stressful environment. So I like that idea as well. So guys, so in summary, working here in the US has pros and cons, but for me, I like it here because of a good working condition, how organized it is while working, because I'm a kind of person that's a bit structured. I'm a kind of person that is organized, and I wanted things to be done a particular way or a certain way. And I enjoy doing that. I'm comfortable doing that. And also, I like how things here are easy, Things here are very nurse friendly, or when I say employee friendly. That's what we like, where we are comfortable doing things, where it is easy from our end to execute our job. Not to the point that it's easy that you're not working anymore, but in a sense that you are given that freedom to do your job well because it's simple, it's not complicated. You know what I'm saying? So I think those are the things that we need to consider while looking for a job. And for now, I am happy and contented working here in the US. But I'm not saying that working in the Philippines is that really, awful or whatever. I think I'm much thankful with my experience back home because it gives me an important training, in a world where everything is manual, in a world where you really work things out for you to get through a particular shift. The hardship that you have, the training are all valuable back in the Philippines. And I would never regret that I was trained in the Philippines because I am proud to be a Filipino. I'm proud to be a Filipino nurse. And that is, I think, our global mark here in the world, that Filipinos are really hardworking, we are resilient because of our training. And I know exactly at first hand because I've been a bedside nurse back home, back in the Philippines, how difficult it is to be a nurse. You are challenged financially where we're not paid good. I'm sorry, but that's reality. We're not paid good. Working condition is not that really good, but that's training. That's training. I like the training. You become resilient, you become a resourceful nurse, you become smart, you become intelligent nurse. I like the education back in the Philippines. I would never regret to be educated and trained in the Philippines. I am proud to be a Filipino, and I hope you are too, because without our training there, we are nothing. I might not be here in the US without my training back home. I am here because of my training, because of my experience in the Philippines. And I'm proud of it. And I hope you are too. And thank you so much, guys. And I believe that would be all for today's video. And I hope you learned something today. And if you have any questions or clarifications, or if you want me to do some videos with a particular topic, just comment down below. I would love to read that and see if I can do it. And wishing you all the best in your life, and I'll see you soon. Bye for now. It's me, Crazy Nurse RN, signing off. Bye bye.